Nice to finally meet you.
I know, this is nice.
It is nice.
I hate that. What are we talking about today? Oh, we're talking about tearing in childbirth. Two nurses, Hannah and Mandy, uncovering some secrets is this weekend's rant. So Hannah, welcome. I am so excited to be chatting with you for the first time.
I know, this is so exciting. I'm really happy to be here and thank you for having me.
Yes. Okay, guys, welcome back to the weekend rant. I have been away for a week, but that will not deter the ranting from going on. I actually got a message from Hannah about a week ago, and she said, I'm feeling super ranty. And I said, let's do this. So she's with me this week. Hannah, tell us about you. You are an author. You are the author of Baby Talk blog. And
I am.
Hello.
Thank you. So I'm a labor and delivery nurse. I live in Ontario in Canada, just about 2 hours east of Toronto. That's probably the city that most people know.
Yeah.
And yes, I do have a blog, Baby Talk. I'm pretty active on there. I try to blog once a week. And then I'm on Instagram as well. And I just started something pretty cool on Instagram, so you should check that out as well. It involves Lego, and I think Lego is just awesome.
It's so exciting. I'm so excited about it. I actually find you and make sure you pop up really quickly.
Oh, good. Yeah, I'm having real fun with it. My photography skills aren't really at the highest level yet, but I'm learning as I go. And I mean, it's all just for fun, right? So I'm
whatever. It's so good.
Yeah, exactly.
So I'm gonna at the risk of annoyance, guys, bear with me. Hannah is on maternity leave, and she just said she was from Canada. Really quick, how long is your maternity leave?
It's 1 year. And actually the government just changed it so you can take 18 months if you want, but you don't get paid, you get paid the same amount whether you take a year or 18 months. They just stretch it out over the 18 months. So for financially, it's not really feasible for a lot of people to take the 18 months, but it is an option. I know, it's amazing. I think it's better than some Scandinavian countries, to be honest. It's pretty epic. And I'm lucky I'm at a workplace and they top me up for the first 6 months. So I'm basically if I want to go back to work after 6 months, I've been on a full salary up until then, basically, more or less. So it's pretty.
That's incredible. I am so happy for you.
It is really nice, but it goes by so fast. But I think about Americans a lot. I think about how can you go back to work after 4 or 6 weeks or 12, even 12 weeks is too early. I don't really.
Well, I think that is why you and I connected so quickly and so easily, because we both are labor and delivery nurses in hospitals.
Yeah.
And we both think a lot of it is shit. Okay, so we are navigating our jobs in supporting childbearing people, birthing people and their families. We are navigating despite the systems that are in place and their businesses. And so they're not necessarily body or family or female friendly. So that's why we're ranting about tearing, because we have some feels about that.
Yeah.
I want to, I'm so glad, because I'm pretty much going to just be quiet.
Okay.
We both have I have my notes. Don't.
No, I'd love for you to jump in at any time if I go too far. I made some notes as well. I should probably have them close by, but I made some notes as well. And I really want things to be evidence-based. It's one thing you can rant and be upset and disgusted at the system, but in the end, if you go back to the evidence, then you always have something to kind of back you up, right? So
yes, exactly.
Really,
so,
go ahead.
First, I want to start with a question, because I want you guys as listeners and viewers, thank you for joining us. I want you to participate in this, because this is not just our feelings. This is coming from years of helping birthing people have their safest, healthiest birth possible. And that is physical, but it's also mental, emotional, psychological, and helping them, navigate these systems. So my question to start the conversation below in the comments, which is my favorite place once this video ends. How would you feel about seeing images of vaginal birth? Right? Because I was going to ask you, Hannah, but we are so jaded. We have been in this zone for so long. And also we might have had like before or around having children.
Yeah.
So we might have already had an interest and been reading these books and seeing these images. Quite possibly, it's probably like hard to distinguish the chicken or the egg at this point. So community, how would you feel about seeing a vaginal birth, the images? Because I have some ideas. I teach childbirth education and, you know, I get groans and I get like curiosity, like the crowning, the image or video.
I think that's a great question because honestly, I think women should want to see that more. And I think we need to see that more. To me, I kind of compare it to breastfeeding, like breastfeeding in public and stuff. I think one of the main reasons women are so uncomfortable breastfeeding in public is because they don't see it enough. So the same with birth, like if you don't see it and you don't know what to expect, it makes it scary, right? So hopefully it'll be a positive reaction and people do want to see it. But everything I see on Instagram and on Facebook with birth, I want to post everything I see. If I see like, you know, the crowning, the vagina and everything opening up. But then I think, wait a second, not everybody wants to see this. So maybe I should like hone it back a bit. But yeah, I mean, I don't know if you know, but it's just recently that they allowed images of birth, like that graphic images of birth on Instagram and Facebook. There was this huge campaign. Yeah, you probably know about it.
A little bit.
I thought that was awesome because I think that really like, it's going to help women in the end, because I think that's one of the main problems in our whole system, and not just in the system, just in our culture in North America, is women don't really know their body and they don't understand their body. They're scared of their body. Like almost anytime I ask a woman when the baby's coming, if she wants to touch like her perineum or the baby's head or whatever, oh no, that's gross. I don't want to do that. Not always. There's some women that actually do want to do that, but I find it quite common that they say no to that.
Yeah. So cesarean has been in the media for a very long time. Mm-hmm. Surgery, and male genitalia also.
Yeah.
So not to put a dig on men, but just to compare in our society what we find okay and then what we find not okay and also terrifying.
Yes.
So having that be in the dark, that like knowing our bodies. Do girls know where babies come from? Do they know the ability of their genitalia? Yeah. And then question number 2. So if you've got that one, and this is totally safe. So like a-holes, I delete their comments. This is like a discussion that you don't have to agree with me, just like every other rant I've done. Do you prefer, because fear is one of the biggest things that I hear that keep people from, achieving like their best birth possible. I truly believe that. So being fearful and like holding back and not learning what they can ahead of time so that that gives them a little more power. And like you said about their bodies, about what's going to happen, the feels that are coming are super scary. But I think not understanding takes away your power, and not seeing and knowing what's coming takes away your power and gives power to the other people that have seen thousands of births possibly 100%. That are with you in the room.
Yeah.
Like your medical providers. So that includes us as nurses, but we don't want that power. You and I don't want that power.
We don't need it. No,
we don't need it. No, we try to like, get it into your head in the 6 hours or 12 or 15 hours that we can make an impact in your life. Okay. So second question down below. And then I want to hear about we have our books here. So if you're not reading this with us, then you should be reading our book. Question below while you guys are listening to our rant. Would you rather be in the dark about seeing those images, never seeing them, and staying fearful, right? Because that's what happens. Your fear of the unknown, you get really afraid of like, oh geez, I don't want to see that because I don't know what it is. Or you miss out on seeing other vaginas and their capabilities. So you're not sure what yours can do. It's never done it before.
Yeah.
Or would you rather be familiar with it and what your own genitalia is capable of? And that's what we kind of alluded to. So would you rather kind of like jump that hurdle before birth or during? Because if you're pushing a baby out, it's going to happen, and that can be super fearful.
Yeah, for
So
sure.
those are what I want to talk about down below. So hit me with, like, what was the biggest thing that stuck out to you when you were rereading Ina May's Guide to Childbirth, and just that
Yeah.
section, or some of your Instagram people that you follow?
It was just that section. It was just random. Actually, the book was just out there. I wasn't actually even rereading the whole thing. I just have it with me every now and again, and I just like open it up at random sections. And I guess maybe I should read what I saw. But it was basically that chapter about forgotten vaginal powers.
Yeah.
And the sentence that kind of like opened up my mind was that the births that she saw in the beginning, so they saw 50 births, and 43 of them had no tears at all.
Yeah.
The other ones that are left over had very minimal tears, right? And then she said that most women are well equipped to give birth without the slightest injury, given the appropriate help, preparation, atmosphere, and consideration. And so all of a sudden I just started thinking, like, tearing is something that we look at as almost normal. I feel like I even say it to patients or women, and I'm like, you're most likely going to tear, especially with your first baby.
Mm-hmm.
It's okay. The doctor will put stitches in. I never had really taken that thought further and thought maybe it's not actually even normal to tear. And there are ways that we can like prevent it in different ways, not the more typical, perineal massage, all that stuff. I mean, we can get into that if you want to, but more like the mental thing. So she was talking about images that she shows women, like statues. I can't remember. I think there's some indigenous statues or something like that where a woman is like stretching her vagina and opening it really big. Yeah. And so she shows women that. And then like mantras. I think one of the examples she took was giving this lady a mantra saying, I'm going to get huge. And then talking about like engorgement, and like talking about how like male genitalia gets engorged, women's does as well, and maybe there's a function for that, and it's for birth. And so maybe you can touch yourself during birth. And I feel this is probably pretty controversial stuff as well, because people don't really connect, sexuality with birth, but we have to kind of admit that it's very connected. I mean, how did the baby get there in the first place? Number one. Number two, oxytocin is a huge thing that is connected with birthing, right? So birthing and sex. So it just got me really thinking like kind of a step further and wanting, to stop normalizing tearing, because maybe that shouldn't be normal, right? So that was basically my thought.
I love it, because I was taught, and I don't even think it was in nursing school. I think it just was on, at work, like on the unit. What most people say is, don't worry, everyone tears. It's normal. And I didn't let myself get into these like other alternative looks, because it's it's controversial. I had to figure out kind of like where I stood in it, but also it's very non-medical. So it's this like juxtaposition of, I really want to help like preserve, dignity, preserve respect, preserve physiologic function, I think is the safest way to help, honor someone's birth. But I had to learn what that was, because that's not medical. Medical is fixing things.
Yeah, exactly. And that's the other thing. When you're in a hospital and you work with OBs or midwives, well, mostly OBs, they're trained for surgery, for suturing, for, like you said, for it's medicalized. It's they're there to fix things. So tear, no problem, I'll fix you up, instead of thinking, okay, wait, maybe we can completely avoid the tear. So I kind of wanted to go into like the research behind it. So I looked at the Cochrane review that they've done about perinatal tears, and it was really interesting. I never actually read it, but the things that kind of stood out to me, if you want to hear that now.
I do, yes.
Was that, so there's no difference in tearing whether, so they said a hands-on or a hands-off method.
Right. So tell us what that is.
I'm thinking they're talking about, when they do the kind of like stretching and stuff.
I hate that.
I try like never to touch a woman there unless I absolutely have to. So like, yes, there are instances when women have epidurals, they're not pushing great. You have a conversation, you say, I can maybe help you out if I touch you a little bit down there, give you some pressure, it might help you to push in the right areas. So there are instances where it's
where you feel rectal pressure
mm-hmm.
because of the application of where I applied gentle pressure.
Yeah.
You can direct your pushing, move the head there, and then I'm not doing anything, and then you're still feeling the pressure because the head is sitting now on that muscle. So that is what, like, very rarely I can do.
Yes,
if it's helpful. If it's not helpful,
And I remember from when I was a beginning, like when I'm a novice nurse and I'm looking at that in the beginning, and I remember always thinking, why do people do that? Why is there so much stretching and touching going on? And I feel like I've seen, damage being done when they're doing that.
Absolutely. Yeah.
Because of that, I don't think people would ever talk about it that way, but I actually think it can be detrimental to your tissue, like the way that they're stretching. So anyways, there's no difference between hands-on and hands-off. So letting a woman just push out without, them touching at all. But the interesting part about that was that episiotomy was more frequent in the hands-on group because they're there, their hands are there, they're touching. Oh, you feel tight, you feel tight. Maybe I'll just give you a little cut and, we'll get it through. And
of course you're tight. Your baby's head isn't there yet.
I know.
I've seen vaginas do crazy things where I was like, what's gonna happen? And like, no tears. I'm like, I totally don't understand the body after this experience.
I know.
You just have no idea.
And that's why I think kind of Ina May comes in again with the more natural approach to birth, is when you don't have an epidural, you don't have any kind of medication on board, you're listening to, you're completely in tune with your body, you're pushing with your body, there's no directed pushing, then your body does what it's supposed to do, right? But when we're in a hospital, and because of the reasons you mentioned before, it's a business and all that stuff, and the culture of how women give birth and all that, it kind of takes away from women being able to birth intuitively. And then that's again with the cascade of interventions, like they get an epidural, so we have to help them with the pressure, and then it's a business, and so doctors or the system, or I don't know what you want me to call it, they have other things they need to do, and understandably so. Again, they're there for multiple reasons, and one of them is to get women in and out, right?
To have babies. So I think
it's unfortunate, and I don't mean to put blame on anybody. It's just how the system is set up and how our culture has kind of evolved to.
I think you talked to a really passionate OBGYN who really loves the power of birth and loves helping families build and grow and see how strong they are. And they are also freaking frustrated by their limitations. 100%. Like they have to see a certain number of people in OBGYN office, or, they have to sleep in this increment of time because they're going to have to work in this increment of time.
Yeah, exactly. Yeah.
And it's business, and you and I have business, and we understand, juggling and, the give and take, but birth in a hospital is a juxtaposition.
It is for sure.
Is totally not, they're not made for each other. But so a few things from what you just said. Ina May, it's not or either.
Mm-hmm. Yeah.
So I used to think that. Okay, you're either crunchy or you're not.
Yeah.
And then if you're not, you're going to be cool with all these other things. And if you are, then this is your way. But women and families and birthing people are not like that.
No, it's not black and white. No, not at all.
No, not at all. I mean, there are so many people who are like, give me an epidural at the door. And I have a fear of pain and I don't want to do this. And I know I can do it without the pain. And I'm ready for an epidural. And they don't want you clawing your way to the baby.
Yeah, exactly.
No, they're not just like laid back body, like do with me what you will and pull my baby out. No, there's so much middle ground that I'm actually taking this book tomorrow with me when I talk to a group of OBGYNs. And I know, they're going to be like, what the hell? But if you're wanting to learn about physiologic birth, you learn it from a midwife who specializes in physiologic birth. If you want to learn about high risk birth and pregnancy, you learn from an OBGYN who specializes in high risk interventions and surgery, right? So it would totally make sense that we can all learn, both ways and find your middle ground. You learn all the options. Like maybe you're not going to touch yourself in birth, but that doesn't mean that other people can touch you if that's, you get the weird jitteries that we get when we see that happen. Like that's totally normal. That's like, you wouldn't want someone walking up to your mouth and being like, I'm just going to open it. Like,
let alone your most private and intimate area of your body. Like
so it doesn't have to be done. Okay. That's what you're saying. It doesn't have to be done.
No.
And it's not found in the evidence to be useful.
No.
Actually could potentially be detrimental if it leads to an episiotomy, which it increases the risk for, which is damaging and only very rarely helpful. And there's evidence for that. That's in ACOG. That's in the American College of Gynecology, OBGYN. Those are the bulletins that come out that help direct the U.S. doctors, and they're a step beyond the evidence. They take the evidence into consideration, and they meet with a group of professionals, mostly OBGYNs, midwives, and they say, this is what we believe, and this is what you probably should be doing in your practice. But then you said that innate ability. No, I don't think you said innate ability. You said like be really in tune with your body.
Yeah.
And in a trauma sensitive frame, that's scary. That's
definitely.
So if in my ears, that's scary, because what the hell is being in tune with your body? Like, I was on birth control for how many years was I on? 15 years or something before I had kids or thought about having kids. So how do you be in tune with your body?
Yeah, that's a good point.
What, can people have babies without being in tune with their body?
That's a hard question. Obviously, they can, for sure. But is there something you can do to prepare in advance so that you become in tune with your body? And are the people you can talk to work through whatever issues you have, or before you're even pregnant? Hopefully, if you could.
Yeah, totally. I think having a support system that is in tune with birth helps with that. So if you're not understanding the feelings that you're having, or you're not like, oh no, my body knows, like, I'm just going to let it go. You're like, I don't know what's going on. Someone is there, your nurse who knows physiologic birth, your physician or midwife who knows your doula, your mother, your sister, your bestie with 7 kids who had all of these at home, whatever that looks like, usually female, a lot of times female. In our history, it's been female, of someone who's like, no, this is totally normal. Just keep going with it.
Yeah.
Instead of like, I don't know, let's get in the bed. Let's get examined. Let's see what's happening. Let's analyze. Let's make sure it's not a problem. Like, you're going to know if it's a problem or if it's not a problem, but you don't have to know that. So you don't have to be in tune with your body.
Okay. Yeah.
It's hard to like ever commit to that. I mean, I think people on Instagram that like post pictures of their own vagina could probably say they're into their body.
Oh, 100%. Yeah. But I feel like, to me, being into what it means to me personally, being in tune with my body is almost like, as I get older, getting to know my body more and more. So I feel like if we think about our younger patients, a lot of the time, and it's not their fault, it's just that as you get older, you kind of start to understand the inner workings of your body a little bit more.
Yeah, you have more time with it.
But everybody has intuition. I want to argue that. Like, everybody has, so yes, you can maybe say you're not in tune with your body, but there's always that thing in the back of your head that's telling you, is what I'm feeling right or wrong? And usually that little voice is right. Usually. I mean, not always, obviously. And like you said, that's why you have that support. What does that mean?
Usually right for you. I mean, who's going to say like, your intuition's wrong? Like, okay, you thought your water broke, but you peed on yourself. But actually it turns out that a lot of times, like, there's some misinformation there that mother knew.
Yeah, and how many times has that happened to you? At least it's happened often to me, where a woman comes into triage, like kind of barely in labor, but she's like, I feel like the baby, like it's gonna happen soon. You're like, it's not gonna happen. Like you have this feeling, and right? And we need to listen to people more.
Hannah, that's my favorite.
And not pretend we know everything.
That's so good. Yes, not pretend that we know everything, but also earlier and give that power to not give. I don't have a power to give. I have, what is it? Like, I think empowering is kind of like diminishing.
Yeah, I hear a lot like hold space.
Yeah, I like that.
I don't love it, but I feel like that, I understand it. It's to me, I'm getting used to that saying, but that's maybe closer to what we are talking about.
Yeah, and with more knowledge, and so by now you know how Hannah and I feel about images of birth. More knowledge, I think, gives you more understanding, more power, more forethought, a stronger intuition to listen to, and not just completely surrounding yourself with things that you don't want.
Yes.
Actually things that you want to have happen. So if you want a vaginal birth with an epidural, not on your back, not screaming, not scary, then go find those birth stories and surround yourself with those birth stories, and stop asking people how they almost died.
Okay.
Or permission for that, or any other way to do it, completely naked and whatever. I mean, there's so many.
I know. There's so many variations of normal. Like every single birth is unique, right? And single person's experience is unique. And I try to remind myself of that every single time. Yes, you have experience as a nurse or experience as a doctor or midwife, but that doesn't really mean you have experience for that particular person, right? It's a new person, it's a new day,
That's why we do this, because it's
exactly.
such a surprise.
Yes.
Right? It's like, wow, I did not see that coming.
Yeah.
Every day. So I have a question for you.
Okay.
If I can ask you. So Hannah, as someone who's seen more vulva than the average person, I would love to have seen that come out of your nose. Are they completely ruined after having a vaginal birth?
Good question, because that's probably one of the biggest fears that women have, and men.
And men, exactly. Yeah.
You were talking about being desensitized before, and I think in a sense, I very rarely think about that. The other thing is we see the vagina or the vulva at the time of the tear and not at the time of the repair. And something that I always keep in mind, we see the repair, but we don't see the after effect.
You don't see it a year later.
No, exactly. Unless you've had a vaginal birth yourself and you've had a tear and you've looked down there with a mirror yourself, then it's really hard to. That being said, I do know that the vagina is extremely, what's the best word? It will bounce back very well, right? So it might feel and look gruesome when it happens.
Heck yeah.
But no, I don't think that's not something to be afraid of at all.
No. So if you've seen someone come back on their third or fourth baby, they're not wearing like a cup to hold up their vulva.
Oh, no. Right. No, exactly. Good point.
Even if you did a vaginal exam, could you, in the game of labor nurses, were on a game show.
Yeah.
Can you tell? Even think that.
Like a Coke challenge. Coke and Pepsi challenge.
Coke and Pepsi. Yes, multip or primip. So have you had multiple babies, or have you never had a baby? Do you think you would be able to tell?
No, I think only if you'd have like an extreme, like 4th degree tear that needed like some crazy repair with like a fistula or some crazy bad issues, which are extremely, 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 extremely rare. Like I don't really see 4th degree tears almost ever.
Right.
So unless that was the case, I don't think I could tell. No.
So that is for maybe the partner's perspective of the tear or a repair, or feeling like, I think those feelings are valid. Like what's going to change for us? Is she going to be different? And then the birthing person and I remember feeling that, like, what am I going to look like? What am I going to be? Not that I look at my vulva all the time.
No.
But what's it going to feel like to
part
be
of your body that you walk around with all the time, every day.
Right. Yeah, exactly.
So it's normal to think about that. I think when people ask about that, they don't really ask, but if I feel like I sense that they want to talk about that, I say, unfortunately, and maybe fortunately, pregnancy on its own changes things.
Yeah.
So regardless of how you deliver or, what happens if you tear or don't tear, there's going to be change, right? And it's just going to be different.
It's very different when you're pregnant.
Yes.
But it doesn't stay like that.
No.
No.
But there can still be changes.
Swelling.
For example, I've had 2 kids. I've never had a vaginal birth.
Right.
I've only had C-sections, but still you feel things just kind of get a bit rearranged down there. Like, not in a bad way. I hope the stuff I'm saying is not scary.
I can't find my clitoris to see my body.
It's like that filter on Instagram. Have you seen where your eye like moves around here and then your mouth is up here? No, it's not like that.
Not a filter. It's not a vag filter. It's like find that zone.
There's change. And I mean, in a sense where there's change, there could be positive change too. It's not always negative, right?
Yeah, totally. Yeah. Yeah. I never thought I would be here talking about my vagina, but I was just telling someone the other day, they were like, once you go vaginal, you never go back. And I was like, that's not true.
No.
I think both my partner and I are completely fine with my anatomy post children vaginally.
Yeah.
Like,
and I think most people are. It's just something, I guess it's something women think about. And their brain kind of goes there and wonder. And then once you kind of go through it, you realize this is not as crazy as I thought it would be.
I did have a friend text me before I had children, after I was a nurse for few years. And she was like, why didn't you tell me not to look? And she had a tear. Not
like afterwards?
Oh. Yeah, right after.
Yeah.
She like ran home with a mirror. And I was like, why would you? If you're curious, I mean, it's your body, go for it. But
yeah,
it's like, I wasn't prepared for the mess. It's swollen. I mean, whether you tear or not, it's going to be kind of wrecked for a minute.
Yeah, there's something major happened to your body. And like, I try to tell women, like I said, don't look at it negatively. Your body did an awesome thing, like an amazing thing. Your child just came out of your body. Like, that's amazing.
Yeah.
Don't focus on the here and now, what it looks like right this second. Look again in about 6 weeks. And
like your cesarean scar, like it's not going to look like that next year.
No.
And it's totally awesome what it did for you.
Yeah, exactly.
Yeah, owning that like headspace of I'm going to decide that I'm going to, and I think maybe like a lot of things, being on the other side of parenthood, have a human to relate that experience with.
100%.
Like, okay, so I'm different, and not a lot, but there are women who can feel the difference with sex, with walking, with their everyday life. That's uncommon and should be addressed.
Yes.
Can be fixed either like outpatient. I know some OBs, they're surgeons. I mean, once things have settled, it's not vain to be like, what's up down there? And can you take a look with a
100%. And the sooner the better, right? Like, don't live with that forever and thinking this should be normal. Just go and ask, is this normal? Am I feeling that something's not quite right?
Yeah, you shouldn't be tugging or hurting or any of that. But a lot of, I think what you're saying too, and just a quick plug for pelvic floor health, is your pelvic floor.
Yes.
And are those muscles from being pregnant? And that's why we change. And sometimes it's the pelvic floor muscles, which are like over 30 of them, you can feel in your vagina, and it's not necessarily your vagina. So having a pro look at that and then refer you to another professional, which is a pelvic floor PT or a pelvic floor specialist. And they're far fewer than OBGYNs, but they do specialize in the correct strengthening. It's not just Kegels. Like it's abdominal strengthening, it's hip strengthening. All those things. But
I think that is very up and coming now. There's a lot of talk about pelvic floor health and stuff. And I really think that should be one of our postpartum things that we teach, right? Should be pelvic floor health. We'll get there eventually.
We'll get there.
We'll catch up.
What would be your biggest, like if someone was afraid of tearing and you say, you don't have to tear, like plenty of people have babies and they don't tear. Yes, everything's wrecked for a minute. It's swollen and you wear the ice packs, but tearing is not the goal.
Mhm.
So like being your biggest perineal advocate, you are your own biggest perineal advocate. What do you suggest? Like maybe either to parents or to nurses, what can you do?
That's a good question. I knew that was going to come because that's what I've been thinking about a ton. And I'm trying to think what I do in my practice and what I talk about. And I feel, I'm just going to be like brutally honest. It's not something that I've focused a ton on, but now, like when I go back to work, I'm definitely going to think about more.
Yeah.
Right now, what I've done a lot is like a warm compress and stuff like that in birth. But I think even more important than that, and that's sometimes not under the nurse's control, it's the whole team, is to let everything kind of stretch a little bit more, like for a little bit longer, if you can. If there's any way you can let the baby kind of come out a bit, go back in as much as possible, it's not a rush precipitous delivery, that's going to really help because it's going to kind of naturally stretch and give the baby a lot of space. Now, that's not something you can always control. I'm aware of that.
Right.
But sometimes when women have really good epidurals, and the baby's just kind of sitting there and they're like, oh, I don't feel a thing. And it's kind of, okay, just let the baby sit there for a bit. The baby's heart rate's fine. Everything's going really great. Let's just stand around and have a laugh until this new life enters the room, right? And so you just kind of, that happens every now and again. But I think that's probably rare.
I don't think it's rare.
No?
No. Well, it really depends on the team. So
yes, exactly.
So for in my like childbirth educator hat, I would say then the parent early needs to have this conversation with their provider. Like, hey, if I had a great epidural and my baby was like coming out slowly, like, how do you feel about that? What?
Chilling.
If my baby was chilling and we had a laugh, I don't know what you do in Canada. Do you have a drink? Maybe if we had a drink. No. But no. Yes, I don't think that is rare, but I do think that a lot of people are in a hurry.
Yes.
And your provider, the system, I'm not dissing on providers.
No.
They are, and when I say, when you have a tear, you want a surgeon to be repairing, right?
100%.
Go to the ER, you got a gash on your face, you're like, plastic surgery. I learned that from Grey's Anatomy. You want a plastic surgeon fixing you up. You want the best of the best. If
it weren't for the modern day OB system, I would probably not be here. So I'm very grateful, right?
Yeah,
like,
exactly.
We need our system. But the thing is, are we overusing it sometimes? That's the question.
Yeah, and the misunderstanding that someone else is looking out for your perineum more than you.
Yes.
Or someone else knows better than you is not always the case.
No.
Having that conversation with your provider, having a slow, like crowning stage, that means preparing the people in the room with you, because I think that you might relate to this with your patients or your clients, that when the end is so near, like you just want to be done. Like
100%.
Especially with that hard part. It's hard in a different way, but pushing harder than you think.
Oh yeah.
Yeah. They're like, no, I'm pushing. And I'm like, well, you haven't moved the baby. Okay, that push moved the baby. And they're like, you're kidding. No, I'm not doing any more of that. It's way harder than I expected it to be.
Yeah, it is really hard. And totally understandable. You've been waiting 9 or 10 months to see your baby. You want to meet the baby. But just wait a couple more, like maybe even just, 5 minutes. Like just
I was like 4 minutes.
A little bit longer.
Yeah. And I think your provider wants to do right by you. They want to help you. They want to help you meet your goals. And at that point, your goal is to be done.
Mm-hmm.
But if you have prepared with your team, you've talked with your nurse, has gotten to know you and your priorities. If your nurse has asked like, hey, what's your biggest thing? If there's time and space for that in your birth, of course, is not the time.
Or write it in your birth plan. I'm a big advocate for any kind of plan. I don't care how you get it out there, but have some kind of, have an audio plan. Whatever you do, just have some kind of information for your team.
Yeah.
The team that you don't know beforehand, right? Like it's one thing. I guess what is it like in your hospital? Is it typically your own personal provider that delivers your baby, or is it whoever's on call?
Yeah, it's someone who doesn't know you. Your nurse you don't know, and they're in a practice.
Yeah. So
You
I'm
don't know
very
your
big advocate. Put it in your
Yeah.
birth plan. Put
Yeah, you
whatever
don't
you
know your
can think of that you think benefits you in your birth plan.
Well, then reminding your team, like, remember to help me blow. And they're not going to remember, but if your nurse, if a few people are like, wait,
Yeah.
and yes, I want her to be able to do her thing and like, and listen to what's going on, and you're having these huge, enormous contractions that are helping push your baby. But if some of those contractions are like, we can add in some puffs of air or some
Yeah.
blowing or some
Yeah.
moaning instead of like your biggest push ever, because she doesn't know that the difference between you have an hour left and you have 5 minutes left a lot of times feels the same.
Mm-hmm. It's true.
So she's not going to be like, and that feeling, the reaction is either to run for a lot of people, like be done,
Yeah.
in that, and that's great, like change positions and don't push, and you're kind of doing that same thing, you're kind of just waiting, or we got to be done here, like this, I don't want to feel this anymore.
Yeah.
And so increasing the time, you're saying, can help
I
that
think
like
so.
slow stretch
I
progression.
think so.
I love
But
it.
I wonder, I actually didn't look up if there's any actual evidence on time. Like, how would you even measure that? I don't think you could even like do a randomized controlled trial on
No,
that.
you'd have to like tape measure how much of the baby's head is out. And
Yeah, exactly.
no, I've looked and I couldn't find any. That doesn't mean there isn't any.
No, there was one thing that was interesting to me in the research, if we go back to that, was, when they're delivering the baby, a midwife or a doctor, and they kind of control the baby's head when it's coming out. So they almost always do that.
Yeah.
I'd say.
Yeah.
It's called Ritkin's maneuver. Never actually knew the name for it, but that's what it's called. And actually, it was interesting. This is in the Cochrane review as well. It does reduce first-degree tears, so it's good for first-degree tears, but it increases the incidence of second-degree tears.
Come on.
Can you believe it? Like, it's something that is routine that most providers do most of the time, and it's actually maybe not even beneficial. So that was very enlightening to me.
That's interesting. I think,
Yeah.
like, I don't know. There was one recently that I read that it was either upright positions decrease first degree but increase second degree, or
I saw that too. Yeah,
decrease the time in labor or the time of pushing. And maybe not maybe. I think they also decrease like assisted delivery, like a vacuum or forceps.
Yeah.
So there are still benefits of being upright, but like randomly also you can tear in certain positions, and then the hands-on thing, I saw that. So it's totally not clear, like this is what you totally should do.
And just to preface the whole research and evidence, unfortunately, this Cochrane review, most of the outcomes that they found, they said, more research is needed. Some of the data isn't, what do they call it? What's the word? I can't remember the word, but it's not like the quality. The quality of the data isn't high enough to actually be sure of the outcome, but these are what they recommend, kind of thing.
Yeah. So. And it's hard to study this stuff.
Yeah, obviously.
Yeah.
But it's interesting. To me, it's like, I love thinking about the culture of how things progress and how we do certain things. So, they do these Ritkin maneuvers, and all providers really do them. But if you actually look at the evidence, maybe there's like not the greatest evidence for that.
Yeah.
The same with the hands-off and hands-on stuff. Like almost all of them do some kind of hands-on stuff, but there's no evidence to support it. So we kind of do all kinds of things that we think are right, but they're not necessarily really helpful.
Right. So the intuition of the birthing person is the most valid data for that particular birth experience 100%. Than our routine things that we do.
And I think also we just have the tendency to want to do. It's like we're here, so we have to do.
Yeah. Like
the philosophy of just standing back and let things happen is extremely rare.
Yeah. And I think that comes from education, from providers and nurses. I think get more education on listening and, giving time for things and giving space and having silence be like, that's a skill.
Yeah.
and waiting and being still is a skill. We learn presence in labor support classes, and we learn the fact that you're female and that you are present even if you don't know what you're doing.
Yeah.
Studies have shown is helpful. It's helpful for the birth experience, and it's also helpful when she looks back on her birth experience and how she felt. So shit could be hitting the fan, and if she had someone there giving her that space and being present, she felt a better. She had a better feeling of, you know, how that went than maybe I did. If I were like, really? Like, that was a disaster. Of course, I'm not going to say that, but she would be like, you know, I felt supported and I wasn't scared. And I'm like,
yeah. And that's the main thing. That's what you really want. Yeah.
Yeah. So not doing something can also be incredibly helpful. But, you know, I think doctors and midwives, mostly medical doctors, are, you know, encouraged to do. Also, I explain to patients every time they go into a room, they do.
Yeah.
You know, they take care of 20 people at one time or 30 people at one time, and they go into a room and they check and they break water and they handle an emergency and write a prescription. Like, that's what they do. That's the business of it. And so they come to, like, that's what they do, but there's nothing wrong with just giving a little minute and being like, you're the bomb.
Yeah.
And nothing's wrong. So
and let's like be kind of open and talk about all aspects, because not everyone's like that. There's lots of providers that are, like you were saying before, they're not all like that.
No.
And we're obviously ranting, so we're talking about the negatives.
Exactly.
So
totally jaded on bad things repeating themselves instead of, you know, what's fun about that amazing doctor that just goes in and sits down and is like, don't let me interrupt this. Whatever's happening is amazing.
Yeah.
And you guys
I'll just hang back here until it's time to catch the baby.
Yeah. You've got jokes and I'm interested in hearing about what, like, you're playing some music and I'm loving the vibe. And they provide this really great presence. And I love calling those doctors in and being like, you know, we need some encouragement from you specifically, because you know this person and you are an authority.
Yeah.
No touchy. Like, she's amazing. I think we just need another person to tell her that. And how powerful is that? Like, they are doing something.
Yeah.
100%. Because of who they are. And that's super powerful. But there are plenty in the system of the business that want to provide an intervention.
Well, I think that's why it's important for women before, like when they're pregnant or even before they're pregnant, to really research where they're delivering, their provider, and like not just research in the sense, oh, they have beautiful birthing rooms or whatever. Look at the stats. Like, what are that doctor's episiotomy stats or cesarean stats? I don't really actually know where you can go to look that up. Maybe you have more information on that, but I feel like that should be something that's open information for anyone to know.
In the US, I don't think it's published for each individual provider, but it is known that that woman or that birthing person's risk, or, you know, kind of risk assessment, is based on the particular provider. Definitely hospital, and also a particular provider within the hospital. And that's for episiotomies. That's for, I mean, they have their own like rituals and ways of doing things that they feel is safest to encourage and repeat over and over.
Yeah. But that's something I think that if women kind of, you know, go ahead and look that up beforehand, that could be helpful too.
That's how change happens.
Culture. What's the culture there? Like, what do they do?
And the culture is to find shit out right now. Like, have you been in a mom group on Facebook?
Yeah, I know.
You're like,
this is awesome. I love it.
Yeah. Like, if one thing happened, you were on blast for years in that group.
The internet, that's the future. I mean, I just love it. I feel like that's the future. People, I feel like providers still laugh at that. Like when I say, oh, I talked to this person on Instagram. I was talking to a nurse about my baby, and it was about breastfeeding and his dirty diapers or whatever. And I said, oh, I talked to this one lactation consultant on Instagram, and she kind of laughed at me. I don't think she knows I'm a nurse, so she like thinks I'm just like, you know, just talking to random people on Instagram. But I was like, no, she had like evidence to back it up. And I'm like, and she still kind of didn't take it, you know, seriously. But I think that's going to change. I think, you know, as we move forward in this age of, you know, technology, the internet's the place to be. And it's great for support. I mean, it's awesome for women, like in your group, to be able to go and ask questions and not be afraid and get, honest answers, not only from you, but from any other women that are there as well. I think I love it.
Yeah. And if you find a group that's small enough, there's less like circumcision bashing and vaccine ranting.
Yes, the rants are not the greatest. But I enjoy actually scrolling through a rant every now and again. I usually don't participate, but I do like just...
You got to see what's out there, because
I know.
It's going to pop into people's heads when they're wondering what's real and what's not real, just like tears, just like, is my vagina going to be the same? Or, what is... I meant to mention that I did read in this book that we're just kind of using as a guide that we love, that the pushing, the normal part of pushing of the baby moves and the baby comes back, baby moves a little, is very different than the the stretching. Yes.
I don't even know what they call it. I tried to Google it actually, like the whole, what that maneuver's called when they're doing the stretching and the pushing and all that. There's very little information on the internet, but it happens in almost every single birth I'm at.
Yeah. And so the commenting that we're doing, the discussion down below, you've told me about what images you want to see or don't want to see, what would help your fear, but also knowing that this happens.
And that you can decline it.
And that so super triggering, one.
Yes.
See this coming at you.
Yes.
But to not know that it's coming, and to not be warned at the time isn't okay, which we see all the time. You and I see that, because that's an intervention on your tissues. That's not necessarily helpful, regardless of whether it's helpful or not. It's a lot of stimulation. Like, that's a lot of feels. You're having a baby.
It makes me think back to the evidence. Sorry to interrupt, but back to the evidence, it makes me think, is the reason people are not discussing it is because they don't really have anything to back it up? Because if it were me,
what would you say?
Thinking about me, if I'm in that situation and they say, okay, I'm now going to start stretching your tissues, I'd be like, is that something that needs to happen?
Yeah. Or do we have a problem?
It's hard to explain that if there's really no evidence behind it. I don't know if there's anybody in your group that knows more, they could maybe comment.
Yeah. I'd love that. Yeah. It's definitely the unnatural type of stretching. I think it's called perineal massage, which is such a funny and positive name.
Okay. I had no idea that they're talking about the same thing there.
When I
found
For me,
perineal massage is a personal thing that I do to myself in pregnancy to stretch things out before delivery.
If I feel so inclined.
Exactly.
Because it's not definitively
Which
helpful.
is, by the way, not really actually supported by evidence that much. It does decrease 3rd and 4th degree tears, and it will decrease the amount of episiotomies according to this Cochrane review. But the regular tears, the 1st and 2nd degree tears, it unfortunately, I mean, you can do it. It's nothing wrong with it. And it's, to me, I think I'd say do it because that's you introducing yourself to
the feelings.
Anatomy, right? Sure. Before delivery. So that's a great thing. And it's not detrimental at all. But
it's nothing like giving birth either.
No.
No. It's not like a dry run.
No.
No, it's kind of separate.
No pun intended.
Right. Vagina jokes. We got vagina jokes. So my recommendation, my like big number one, I don't know if it's number one, but it's one of the things that I'm like, I just witnessed a birth that was like so timely for me in a lot of ways, was how to prevent tears and or episiotomies, because they still happen, sometimes routinely. And I used to say those don't happen anymore, but they do. How to prevent it is not being in the bed, because you have less tears. Actually, you have no episiotomies, very few episiotomies, not in a bed. But then you said the hands-on. So being in a bed, I don't know about the evidence on this because I've been looking at a lot of evidence.
It makes sense to me. Like just thinking right out the bat, like it makes sense. If you're not lying on your back in a bed with like the lights on and all the equipment out. Yeah. It's not going to, the equipment might be out, but the lights aren't on and the shining of the perineum and all that stuff.
Exactly. Yeah. Your perineum might not be actually where you're at is going to be way more pressing on everyone else's mind than what your perineum is doing at that time.
True. It's very
true. You're giving yourself, I think, the help from your hormones, because I don't know about the evidence, but a lot of times people don't care about the evidence. They want a new option. So one option,
that's fine.
we care about evidence because that's the language we speak.
But the evidence isn't always there. Sometimes it is just word of mouth, right? Or what we've seen in our practice.
We've seen what happened 100 years ago. And if you want to go back to that, then women did not give birth in a hospital bed. Well, maybe 100 years ago, actually. Was that right when it began, when men were attending women giving birth, and they put them on their back and shaved them and gave them a Foley and
toilet, sleep and all that jazz?
Right. Put them to sleep. You have to be on your back for all of that. You can't get all of those interventions without being on your back. So you had to be on your back because you would be falling if you're standing up and they put you to sleep in twilight sleep to pull your baby out. That's what happened. That's not what happens anymore. So you don't have to be on your back. But the bed is the thing in the room. The hospital bed is the thing in the room that is unlike anything else in your life. So the hospital bed, I think, is a little more difficult to make personal.
Oh, yeah.
Than the couch.
I have beef with the bed all the time.
Beef with the bed.
I say, when I am bringing women into the room for the first time, usually the first thing I say is, you do not have to get into bed. Yeah. And we have benches, we have chairs, there's stools that the nurses sit on. If you want to sit on a stool, if you want to sit on the toilet, like you do you. Like you find us, but if you want to be on the bed, great. If you want to lie down and be on the bed, that's also fine. But you don't have to. But I find that the bed is almost, in any hospital, I think I've seen 4 different labor and delivery units in my life. And the bed is always
the center of
attention. Yeah. Right?
And that's how they design hospitals. There's nothing wrong with the bed. You know, if there's an emergency, I want people to know where they're going and to get at me. I'll be in the bed. Yeah. There's an emergency. You can find me in the bed and you know where it is. Yeah. The center, the bed is off to the side. The tub is, off to the side. The things that hang from the ceiling are in one corner. The balls are there. There's more space for in the middle to kind of do your own thing. But you can make those other spaces a little more like sanctuaries, a little more like animals give birth.
I don't know. I'm pretty sure there's evidence. I haven't recently looked it up, but I'm pretty sure there's evidence to show the more natural the environment is, the more home-like the environment is, the less interventions, the shorter the birth, the less pain, all that good stuff comes with, less kind of medical environment. Maybe that's not the right term, like a sterile environment or
unnecessary.
Cold. Yeah.
Yeah. Cold, unnecessary intervention. So episiotomy might be unnecessary, but, and we're not talking with an epidural. So with an epidural, you're in the bed, but then having people help you not be on your back.
But even having said that, okay, I know this is going to be probably a little bit controversial, or not controversial, but something that people will be surprised. With an epidural, you can sometimes move around a bit. I'm not saying walk around the room. You're not doing laps or running around. But I have more than once and more than twice gotten a woman up out of bed, sat her in a chair, cleaned the bed. Like you have a long induction, you have things going on. I have done that. That is not the norm. I understand that. But I feel like people are closed off to different things when it comes to epidurals. I have seen in the past.
That's crazy. I'm going to just say that. So crazy. It's totally not allowed where I'm at.
Okay, interesting. Because where this happened, I'm thinking one particular instance, but I have done it more than once. The anesthesiologist said it was okay to get them out of bed if they're able to do the step test. So that is like you can step up and then step back down. And some epidurals are so heavy that you would never even think to try to get them anywhere close to the floor. But then some epidurals are extremely light. I mean, they're still working very well, but the woman is able to
phenomenal. And stuff. I would love to one day have like a more, I don't know, where you could like dial it in a little easier.
Yeah. But can you do hands and knees where you are with an epidural?
With some. Mm-hmm.
Yeah.
Yeah. I think as long as it's safe, but now I don't know if it's policy, but it's definitely, I don't even know if
it's not the culture.
No, no, I would be fearful for the repercussions. Now, I'm not going to, of course, I've never said like, I'm gonna, whatever, there's a consequence if you get out of bed. I'm just like, I'm super fearful. Please call me and tell me if you're going to get out of bed.
Yeah.
And I'm going
Preface
to
this
try to
with do
stop
not
you.
get out of bed without talking to your nurse if you have an epidural.
I usually say it's not a thing because I think majority is it's not a thing.
And typically it's not a thing. But that being said, you are the
Get creative.
peanut ball lady, right?
Totally. Yeah.
You can move around in bed.
Yeah.
Like there's so many different positions you can still get into, like in the bed. And I find that a lot of people, both birthing people and professionals that work, don't even know that. They'd be like, okay, you can go on this side and that side, that's it. I remember just recently doing hands and knees with someone with an epidural, and it was a newer nurse, and she said, like, we were working together, I can't remember why, but anyways, she said, I've never seen this, you can do this? Oh my goodness, this is amazing.
You need help. You need help. You need multiple people to help with that.
You need help, yes, definitely with all your wires and all this stuff, but you can do it.
It's totally
and
possible.
It's an option. And
I
think women don't even realize that, right? And when you don't know that, you're not going to ask for it.
Right. Yeah, that's why I do what I do. I'm like, hey, you need to know that this is a thing so that you know how to ask for it. And yeah, I did the same thing with a few doctors recently. They came in and I was like, hey, called you for delivery, and she's hugging a peanut ball and she's resting. And they come in and she doesn't have a contraction for a minute because that happens sometimes. People come in and your adrenaline's up and your contractions are like, gotta go. We got to make sure we know these people first. But they were like kind of standing around, and I was like, "You're gonna have a baby."
Yeah.
And they were like, "Okay." And I'm like, "Can you put your gloves on, please?"
Yeah.
We're called to catch the baby.
Yeah.
And she's on her side, and the peanut ball's right there, and they're like, "Sure."
Yeah.
Okay, this is how it's gonna go. And we're friends. It was funny. We talked about it, and
Yeah.
there's never like proving someone wrong. I never try to catch a baby ever. If you are one of my patients, you know that I am like, I will give you the mom eyes. I'm like, don't make me catch this baby.
Yeah.
Lock it up. And then they laugh and like the baby's coming out.
That does not help. No,
stop laughing. I'm not funny. I'm being super serious.
Yeah.
My kids do the same thing. But they were like, okay, we'll put gloves on. So they put gloves on and didn't gown up and didn't show me that they were like ready. But I was cool because they had gloves on. I don't care if you don't have a gown.
The gloves are there.
Sure, gloves. We all have gloves. Great. And she kind of looks at me and I was like, you do your thing when you feel that pressure. And she just pulled that peanut ball and pushed, and then half the head came out. But you just can't, they're not used to seeing births like that. Someone on their side, it's a little sneakier. It's a little like quieter, less dramatic, and for some reason the baby just doesn't sit out like they do. Like it's a surprise sometimes to be like, oh crap, your baby's coming out. Yeah. When they're on their side, and they'll be like, la la la, I'm charting, and I'll be like, ooh.
I know.
But for people who haven't seen it, it's just new. It doesn't mean they can't do it.
No.
Or you can't do it.
Yeah.
Just say,
for sure,
this is what we're gonna do.
Mm-hmm.
Well, this is a lot, and I am so grateful. It is a lot. Grateful to you.
I know. I have like 5 million more ideas of stuff I want to talk to you about.
Well, we can keep going, but we'll stop for the conversation for the
No one's going to listen to this long conversation anyways.
No one. The people here are in their shower and they can't reach their phone to be like, enough is enough. I've heard about my vagina for an hour.
I hope you get people looking at their vagina and looking at other vaginas that are stretching.
Yes.
Birth is beautiful, people. It's beautiful. There's nothing to be afraid of. There's nothing gross, usually. Really, it's not gross. There's nothing gross about it. It's amazing. And my husband just left, but he hears me say this stuff all the time. And he's rolling his eyes when he hears that. But it's true. It's true.
We think it's beautiful. Not everyone thinks it's beautiful. But I think anyone who's been present at a birth has witnessed power.
100%.
Regardless of how that baby came out, it is a powerful time.
It is. And how many times have you seen the husband say, like in the beginning, oh, no, I'm going to stay up here. I'm at the head of the bed. I'm not looking down there. And then when it's happening, they feel so compelled and they just have to look. Yes. And it doesn't look, you guys look. It's not going to ruin anything for you. Has nothing to do with, your desire for your wife. It's your baby's coming out, and it's absolutely awesome. So I recommend looking at pictures, and once you've watched a couple of videos and seen it a couple of times, then it stops being such a mystical thing, and it starts, you start understanding the power behind it.
Yeah. I think if you're not, I used to teach classes and people would be like, oh, I don't want to look at I don't want to see that. But I think if you can't see an image of that, of a vulva with a baby coming through, you're not ready for, like, there's something else that's holding you back.
Yeah.
So what are
something
you
needs to click in your
it'll click. And it can happen at the birth, or it can happen before, if you're like really preparing and being open with your fears and, discussing with your partner, like all kinds of things. Like my husband and I just, now my kids are going to hear this, but I would tell them we had surprise genders, and he was like, what if I'm disappointed?
Yeah.
Like, oh my gosh, that we grew closer because of that really tough, raw conversation that neither of us wanted to have, or really we didn't want that to happen. But I think there's something there, either in the relationship or with you, if you're not ready to see that. And then once you can work through some stuff, maybe you're willing to see it. And then the more you see, you're like, yeah, we're doing this. This is cool.
Yeah. That's the only way to normalize things, is by seeing lots of exposure, right? Exposure therapy.
That's how we are. That's how, like, I have to be careful with PG movies because there's so many guns.
Yeah.
Like, it's so normal. And I'm like, my kid's 4.
Yeah, exactly. I know.
Well, he knows, he can tell you how a baby's born though.
Yeah.
Very normal in our house about the pelvis and surgeries. I don't know if that's good or not, but I'm going to link all of Hannah's links and all of Baby Talk links down below. Also, this book, you can grab it for cheap. That's how I got mine.
It's the best.
At the library.
It's the best. Read it.
Yeah.
Read it.
Yeah, it is good. It's good. There's a lot of stuff in there, but you take everything with a grain of salt. So thank you so much.
Oh, for sure. Take all the information you can get and all the knowledge you can get, piece it together and use it for what works for you, right? Like, there's no one guide and one book that is the be all and end all truth of birth and pregnancy and parenthood. You kind of get the information you can and run with it. Right?
Do the best with it. Yeah.
Mm-hmm.
If you haven't yet seen Baby Talk's Instagram, you've got to go see that Lego story. It's happening right now. And if you haven't seen the informed consent rant that I did a few weeks ago, I'm going to put that here. So check that out next, and I'll see you next week.